This helps us locate what area of the spine there could be a problem. Keyword is could be, because that's one of a handful of criteria that we use. Hey everyone, Dr. Todd from Gonstead Spine Wellness. In this video, we're going to talk about how we change this sort of thing. This is called a head translation, like the walk like the Egyptian dance, right? We have to get really good at this as chiropractors to demonstrate this posture to our patients and show them one of the components of how to fix it, which I'll show you here in a second. So if you want to see how we fix this, then make sure you watch this video. But before you get started, make sure you subscribe to our channel, that you like this video, that you comment, put some comments below. It helps us a ton. Even if you just say, keep up the good work, we love it, keep it coming. Or if you have a specific question, you can comment and ask a question, or you can request something else that we cover here in the future. But commenting helps. Share this with someone else that you think would help them. Remember, we serve two different audiences. One is the public, people that want to learn about natural health and healing, and chiropractors. We teach chiropractors how to put functional movement and corrective exercise into their chiropractic practice, which is a key piece also in fixing and maintaining and helping a patient like this. All right, so patient of ours, let's talk about this. This is an x-ray pre and post, 311 to 614. How far apart is that? About 3 months, about 12 weeks. So it takes about 12 weeks before we can expect to see measurable change on x-ray. So let's say that you are a new patient, you're coming into us, you have some sort of postural problem, some sort of x-ray problem. It's probably going to be a 12-week process of very specific care to you. So it's not a cookie cutter approach. It's not the same treatment or same care to everyone, but it's a very similar frequency and duration. On average, it's 2 times per week with you doing home care and stuff at home that we teach you to do. But it takes 12 weeks. It takes that time, like I said, to actually expect to see measurable change on follow-up x-ray and good long-term clinical change. This is a 12-week span. What's going on with this patient? She has various symptoms. She actually has a hyperkyphosis. She has a lot of problems in her mid-back that have gotten better over time. So she's done really well with that. She had headaches, she had neck pain. But this right now, I'm not really talking about symptoms. I'm talking more of a structural change. And I want to show you like a how-to of how we went from this to this. This is measured right here, almost 13 millimeters of offset, okay, as far as where that vertical normal should be, which is measured off of T4, to over here, it went to 6 millimeters. So 13 to 6, that's pretty good. That's more than chopping it in half, right? That's a very good correction. So now, how do we do this? Well, we address segment, posture, and movement. All 3 of those things have to be addressed. What does that mean? Segmentally, let's go over here. Segmentally, we have her x-ray. Watch some of our other videos. You can see how we do a full spine workup with our patients. I'll put a link up above to one of the workups we did on another patient. You'll see these little white dots on here. Those are BBs that we tape on a patient's spine. The small ones are freckles and moles and scars, and the big ones are where we found a problem in the spine, AKA a subluxation. Front of the spine, back of the spine, bone, disc, bone, nerve in between, spinal cord down the middle. With trauma, bones shift, disc, joint, other stuff swells, irritates the nerve. That's the problem. And over here, the reason that that matters is because the brain controls everything by sending energy down through the spinal cord. Energy comes out through the nerves, connects to every single cell, tissue, and organ in the body. So you want to make sure that the spine, which is like the circuit breaker between the brain and the body, that circuit breaker is working and you don't have flip circuits. So that's what we're trying to do, is improve segmental integrity first. We use the Gonstead system to do this, and make sure as well, another link up above, watch a video where we responded to a chiropractor who felt like we needed to do a better job clarifying that everything that we represent here is not under the umbrella of Gonstead. The Gonstead part is the segmental part. The postural part is Chiropractic BioPhysics. The movement part is our own functional movement systems that we put together called Move Now, that we teach other chiropractors how to do. And we do that here in our clinic as well. So back to this, what did we adjust? Well, there's certain segments in the spine that we adjusted. Her 6 cervical is very extended, meaning it sits back like this. And in the traditional Gonstead analysis, you'd look at this on x-ray and you'd say, oh, that might be a problem. But in the Gonstead work, we don't just look at an x-ray and adjust off the x-ray. We find the problem on the patient. And if you watch the video that I just linked out showing how we do a new patient workup, you'll see that we use this little instrument that measures temperature. This is one of the pieces that we use on exam. And this helps us locate what area of the spine there could be a problem. Keyword is could be, because that's one of a handful of criteria that we use to figure out what we're going to adjust on a patient each and every visit. We check them with an instrument, we palpate for edema, so we feel for swelling, we check motion, we visualize what's going on with him, we palpate musculature. Then at the end of that checkup, right, each and every visit, we then look to the x-ray to see mechanically what is the best segment to work on? Are there any contraindications? What is the best vector or direction of adjustment to get the best correction at that segment? So should we set it more only forward, a little bit from right to left? Should we be trying to angle it this way or come from the left? All of those things are determined off of the x-ray. That's what the Gonstead component helps us with. We find the problem on the patient, the x-ray tells us the best way to fix it. That's the segmental part, okay? So first is unlocking joints that might prevent that head shift from changing, because you'll have individual segments that can be locked up. And if you don't help those, you can do all the other stuff that I'm about to show you, and it's really not going to get you all that far because those individual segments are going to be locked up, preventing the global postural change from actually happening. All right, let's go show you traction. All right, this is called a Meyers wall unit in honor of Dr. Don Meyers out in California that invented this. And how this works, these little sliders help us set the height because there's a specific angle that we're then gonna pull across. You know, in this case, the patient, her head is shifted to the right compared to the rib cage. So we're trying to shift the head to the left. There's some other specifics on this I'm not gonna cover in this video. I'm just showing you the quick little gist of this as far as how it works. These cinch up. There'd be a block here in between the head to keep this neutral, because if I just pulled like this, I would bend my head over like so. So there'd be a block right here, and then we would control the force as far as how this is shifted over. Patient would hang out in here, we'd set a timer, and they would do this for 15 to 20 minutes. But they would not just jump into traction like this cold, okay? It wouldn't be adjust them and then go send them over to traction. Actually, I'm showing this to you in a different order purposely. One is I wanted to catch your attention by showing you what we're trying to change, and then I'm just walking through the clinic of what's closest to me. So let's go to this next piece. Okay, so this is where the patient would actually be starting. And really what they would do first is they'd come over here and they would be doing a sequence 1 warm-up, which means we're gonna be trying to get the cervical spine to start moving better. So there's a step-by-step process of using a variety of tools that you see over here. So neck trigger point tool, double lacrosse ball over here, J cane over here. And there's protocols and then stretches that we show that someone does to increase their mobility, warm up the tissues before they even attempt to get adjusted or to do traction. Then the next part to continue to warm up the tissues is we're gonna do a postural corrective exercise. The head is shifted to the right. We're gonna teach them how to shift the head back to the left at first. Patient's gonna need to watch themselves in a mirror. We use these upright posts as a good spot to hold them in place, and they're gonna shift the head over, and they're gonna go a few seconds into the movement, hold it for a few seconds, come back to neutral, and they're doing this for time, so they don't rush the process. It's not for reps, because you do reps, someone just rushes through it, so we do it for time, nice and slow, and then they will graduate. Once they understand the movement, they'll put a head harness on, kind of like this, with a little tail sticking out this way. This then attaches to elastic bands, and they can now do this against resistance. So they're shifting, there's a resistant load trying to pull them the opposite direction. And then the third stage of this is they wear the band, it pulls them further into failure, they hold neutral, and they add some full body functional movement, like they could be doing a forward lunge, they could be doing a shoulder press, but they're holding neutral to further reinforce neutral posture while simultaneously moving the body in a functional pattern. That's how we do the functional movement part. And then that same patient would be assessed for any dysfunctional movement patterns using our movement assessment. And we'd be fixing their movement dysfunction, even if it had nothing to do with their neck, nothing to do with that neck posture. We're addressing a whole body, and we're trying to get the whole body moving functionally, even if it's not in the symptomatic or structurally deficient area. Like in this case, we're talking about a head shift posture. I'm just telling you what other things the patient would be doing back here in the exercise area. So essentially in this video, we started off showing you comparative x-rays of how we changed a head shift posture, got some great changes in 12 weeks. It's not just adjusting, it's not just traction, it's not just exercise, it's a combination of all those things. And the patient has specific things that they're doing at home. Show you one more thing. And they're tracking what they do at home in a journal. This is called the 12-week transformation. So our patients, all of our patients get a journal like this, and they can track their home care. They set their goals. They have this home care planning that says, if I only have so many minutes, what should I do? Well, good is spending 20 to 30 minutes daily on doing your sequence 1, 2, or 3 warm-up, whichever we assign to you. In this case, it could be sequence 1 for cervical, and then doing your home care traction, which in this case for the head shift, not really a traction. That's a whole other conversation. Let's not get into that right now. Then there's postural corrective exercises like the head shift that I just showed you. This one's showing a thoracic shift, but the head shift exercises, that's better. So spend a little bit more time, do your postural corrective exercises. And then best is spending a few more minutes and working on the functional movement patterns that are new and progressive each time we see a patient, meaning each time a patient's here in the clinic, they're not doing the same exercise every time. They're learning new exercises that progress them further and further. And the way that we track this stuff, which is really cool, is through something called the belt system of functional movement. You've heard of me talk about this in other videos probably, and that is this. Introduction to the belt system. We start our patients as a white belt. They move up through this. Notice I'm wearing a black band because I'm a black belt. And then notice up on the wall over here, you'll see we don't have a lot of black belts because we don't give these away. But these are our black belts. We have Czar Horton, Master Elite Strong First Kettlebell Instructor. I'll link a video up above about Czar Horton and how we use kettlebells in functional movement. And then you see really where it starts is white belt. And patients progress up this process as they learn more and more and get healthier. So it's a way of engaging patients, keeping them motivated, keeping them excited about their progress and their care. And this whole thing works alongside an online membership site that our patients have access to called the 12-week transformation, where they get a username and a password, they log in, they have weekly content that they follow, they track their home care every single week. They answer questions based on videos that they get to watch online and learn about natural health and healing. They track what they do in their home care, and it goes like that week by week by week. That is it. Dr. Todd from Gonstead Spine Wellness. When it comes to the health of you and your family, results matter most.